Hello, everyone. Thank you so much for joining us here on New Day Cleveland. I am wearing my teal today. It is Ovarian Cancer Awareness Month, and as some of you know, this disease is very close to my heart, given the fact that my mom did pass away from ovarian cancer, and her doctor, her amazing, incredible doctor who gave her an extended life, is Dr. Robert DiBernardo. He is here with me today. It is our annual meeting of sitting down on this couch and reminding everyone of a disease and a specific cancer that really is a silent killer, people will say, but you are here today, and I'm so excited because there, as I knew there would be, continuously promising new things that are happening in the fight against this.
There are, and this is why it's so lovely to be back. I mean, this is really important that we message to people because it is traditionally known as a silent killer, but we actually can do more and more. So we have more therapies now that we can bring to bear to really help with this disease and extend women's lives in a very meaningful way.
And I know it is considered rare. So again, this is one of those ones that unfortunately doesn't get as much funding as we would like it to get as far as research goes. But what we're seeing, some of these things, new targeted therapies that are happening right now.
So cancers, our understanding of how they work has kind of evolved over time. And of course, in women's health, I always kind of call it the poor stepchild because we get our therapies after lung and colon and breast cancers and things like that that are just more common. But we have these targeted therapies now that we can understand what the cancer looks like on a molecular level, and there are proteins that are expressed on these cancers that we can actually target with specific agents. And so they essentially stick to the cancer rather than, for instance, when we're giving chemotherapy, that chemo going everywhere, it can stick to the cancer, get internalized, and then it's very effective. And the side effect profile of those drugs are actually generally a little bit more favorable as well. So it's an exciting development that's really been the last year or so. And now that that technology has been worked out, companies are developing a whole myriad of these things, which, for ovary cancer has been huge, but for other cancers, endometrial cancer, cervix cancer, as well as lung and breast and some others. So it's an exciting time for us in cancer.
It is incredible. I want to get back to more of some of the other things that are going on, but first, for women who just don't even realize that there may be some subtle signs for ovarian cancer, I would love to go over some of the symptoms that they might be feeling.
Yeah, and I think that's really important because regardless of our therapies, really identification and prevention are really the two things that we want to focus on. So, the reason they call it the silent killer is because all the symptoms that we're seeing on the screen, they're things that we all get periodically.
Yes, and
abdominal
just feel
pain,
normal, and you just grow to accept them,
Right, so pain, bloating, some nausea, changes in your appetite or your bowels. A lot of women will, oh, you have gallbladder trouble or you have a UTI. The bottom line is, if these things are persistent for more than a few weeks, you should definitely talk to your doctor about them.
It's so important, and I think that is the big thing. Just don't put it aside and brush it off as nothing.
Well, and most women put everybody else first.
They do.
Their family, their kids, their job, all of that comes first, and they sometimes take themselves last. And I think 3 weeks is kind of the time frame that I say, look, if you're having something that's gone on for more than 3 weeks, it's not the flu, it's not something you ate, it's not that you're in menopause. Let's get it checked out.
I couldn't be more accepting of that. I know that is so important. There are risk factors. There are people who might be more susceptible to getting this. I am unfortunately in that category for a few reasons.
Right.
But if you look at that here, I mean, family history, a big one.
Correct. And, if you come from an Italian family like me, like they just said the C word, like they wouldn't speak cancer. But I think we need to understand that family history is really important. We know that cancers can run in families, and a certain constellation puts us at a little bit more risk. And so we take things a little bit more seriously if you have a cyst on the ovary and you have a family history. A lot of cancers, especially ovary cancer, about 1 in 10 is linked to a genetic disorder that we can identify, and then potentially identify those patients at risk before they have the chance to develop a cancer, which is the key to preventing this.
And one of the keys, I know we want prevention, but say someone does develop ovarian cancer. Getting to the right doctor, we're so blessed to be here in Northeast Ohio because we have doctors like you here, but getting to the right doctor, getting the right things done, screenings done, right testing done is crucial in longevity.
It really is. And so we've known for a long time, especially with diseases like ovary cancer, that outcomes, how long women live, how well they live, whether or not they're cured is directly related to where they get their care. So an NCI designated cancer center, they perform the best. Places that are high volume in gynecologic malignancy and ovary cancer in particular, those patients are going to do well. And unfortunately, we have education to do on our part as a medical society, because a lot of people are taught ovary cancer is just the silent killer. There's very little you can do. That's the furthest thing that can be from the truth. So if you or a family member or a friend was told they have ovary cancer, they need to seek out advice from somebody that does this for a living. Don't just take, oh, my PCP said it's too late and there's nothing that can be done.
So important. One of the other things, I know even when my mom was in the OR, you were doing some different procedures back then, but now there's this new fluorescence that you're using?
So, you know, we talk a lot and we get a lot of press on these new chemotherapy drugs, and immunotherapy has been in the news a lot. But we're actually trying to push the envelope surgically, because with ovary cancer in particular, both the quality of the surgery and the drugs that we use for this cancer are important for the best outcomes. So surgically removing all these cancers is important. There's a new technology, the same technology that's able to make the chemo stick to the cancer. We use that same technology, but instead of chemo on the back of that, we have a fluorescing agent, which is pretty cool, so that once I've removed all the cancer, then I can shut the lights off in the room, put a special scope in, and then things that weren't visible to my naked eye can fluoresce, and I can say, oh my goodness, there's something more. So this is new technology we're bringing to the operating room, just like the chemotherapy baths that I've been doing for years. That's been shown to be helpful. So we're trying to kind of push the surgical envelope as well as these technologies get better. So a lot of fascinating stuff going on right now.
It's amazing, and I know you have a newer member on board, Kevin, who's been doing wonderful things.
Yeah, so that's the thing, like, right, we're talking on the treatment side, but you know, ovary cancer, unlike cervix where you can do a pap smear, like, we don't have a screening test, and so Kevin's work is all in early detection.
It's amazing.
I know. So
I mean, it excites me so much, and I know my mom is so happy to hear all of these things, and I know that every woman out there who knows someone who's been. I thank you all for letting me talk with him this morning about this, because it is so important, and you never think it's going to happen to you, and it can. So knowledge is power.
Power, right?
And seek the experts' help in these situations. It's always good to see you.
Oh my God, Natalie.
I thank
Lovely
you so
seeing
much.
you. Thank you so much for having me on.
One of my favorite humans ever.
All right.
And I'm appreciative that you shared all that with us today. Thank you.
Yeah.